Good afternoon, everyone. Welcome to another edition of Your Health Matters here on Kaieteur Radio. I'm your host, Rehanna Ramsay, and today we will be discussing illicit drug use, touching on the subject of addiction. Dr. Travis Freeman of the Drug Demand Reduction Unit within the Ministry of Health is joining us virtually. Good afternoon, Dr. Freeman. Welcome to the program.
Hello, good afternoon, and thanks for having me.
As mentioned before, we will be speaking on addiction. So before we get into our discussion, I usually give my listeners or audience on Facebook, because we do live stream on Facebook, a little tidbit of what we're talking about. So I'll just talk about what addiction is. According to a lot of research papers, addiction occurs when an individual continues to engage in a behavior with difficulty of stopping or moderating. Addiction involves compulsive engagement in behaviors such as drinking alcohol, drug use, or gambling. The compulsive nature of an addiction surfaces as a result of rewarding stimulation in the brain and a subsequent desire for the brain to crave that stimulation in order to induce pleasure. Addiction also often involves obsessive psychological preoccupation with getting, using, and recovering from the addictive substance or behavior. Dr. Freeman is here to tell us a little bit more about what addiction is and how we can possibly free ourselves from it. Welcome to the program again, Dr. Freeman. And I just would like you, if you don't mind, sharing a little bit about yourself and your work at the Drug Demand Reduction. Go ahead, Dr.
Thank you. So like I said earlier, I'm from the Drug Demand Reduction Unit of the Ministry of Health. I'm currently the head of that unit. What we do, we develop policies, programs, and services as it relates to drug treatment, prevention, and also rehabilitation.
And so you will be able to tell us what about the types of, the main types of addiction products that people can get addicted to, and what you see in your reports, in your records, as it relates to drugs and other types of addiction and substances in Guyana. So go ahead, tell us about some of them.
Yes. So firstly, I must say that drug addiction is a mental health illness. But also, I would like to speak a little on what we refer to as drugs, or what we refer to as psychoactive substance. So psychoactive substances are any drug or substance that affects how the brain works, and it causes changes in the mood, awareness, thoughts, feelings, or behavior. And examples of psychoactive substances include alcohol, caffeine, nicotine, marijuana, and even certain pain medicines. Also, I'd like to add that there are even some other psychoactive substances, or what we refer to as new psychoactive substances, that we're seeing trending in Guyana. And these include methamphetamine, which is commonly known as ecstasy or Molly. They're from the same chemical compound. It just depends on who is making the reference. Some people refer to it as Molly, some people ecstasy. Apart from that, we have a lot of synthetic cannabinoids. These are derivatives, or these are chemical compounds that mimic THC, which is usually found in cannabis, or what we refer to as marijuana or ganja.
Yes, and the synthetic drug, crack and cocaine, would fall under that category as well.
Yes, definitely.
Speaking about addiction doesn't just spring up. There are some root causes of addiction, and can you talk to us about that?
Definitely. So we must look at behaviors. And what you would notice, a lot of times people become addicted because they use substances as a coping mechanism. And that is why we are always encouraging persons to find healthy coping mechanisms, which would include reading, meditating, listening to music, exercise. You find that people become addicted because they might be facing a particular situation and they're looking for some sort of relief or coping mechanism. And that is the major thing that leads people into addiction. Also, experimentation. We have a lot of persons who would have been fed misinformation about a particular drug and they experiment with it, and that would lead to an addiction.
Mhm. And these certain addictions are um, linked to cultural behavior as well. Like if you're in a certain culture or a certain, it doesn't have to be traditional, what we would call traditional culture. It could be like the modern day use of the word culture in terms of how, we live and so on. Those things can also influence our use of, our introduction into these things. Do you agree?
Absolutely. Absolutely. In some cases, you can have some societal norms. Like in our case in Guyana, for every social event, we tend to have alcohol present or the consumption of alcohol present. And we know that alcohol is a psychoactive substance based on the definition that it alters your mood, your awareness, your feelings, your behavior. So it's a psychoactive substance, and a regular alcohol use can lead to addiction. Actually, it's one of the more frequent addictions that we've noticed in Guyana.
Mhm. And in terms of, let's say somebody just say they use this, let's say that they want to try, as you said, experiment. Can the person get hooked on one try of, let's say, marijuana or cocaine or something? Just want to try it. From your experience as a medical person, do you think that person can get hooked like that?
So to give you a short answer, yes. We have had cases where persons experimented, and from that very first moment, they've become dependent on it. However, usually it's a cycle where persons would start or would experiment firstly, then you would find them to start using the substance occasionally, then they graduate to regular use. And after regular use, we speak of dependency or addiction, where the person cannot function without that particular substance.
Mm. Uh, Dependency and addiction. What are those two words synonymous? Can they be interchanged, or is there a difference between being drug dependent or addicted?
No, you're absolutely right. They're synonymous. For someone to be addicted, you're dependent on a particular drug.
So we can use those words interchangeably. Is there a worst type of what we would call a worst case scenario in terms of addiction? Let's talk about just
Uh, yes. So addiction is the worst case scenario. With addiction, persons cannot function without that substance. And it's sad to say, even to merely socialize, they would need that substance. To carry out a regular daily function, they would need that substance. And hence why it's a serious mental health issue. And the Drug Demand Reduction Unit is very aggressive with our prevention program, because what data would have shown us is that once you can prevent an individual from experimenting with the substance at an early age, seldom you would find someone starting to experiment with a substance after they've been in a mature age, like in their 30s or 40s. Usually it's our very young people and our in and out of school youths that we need to be very careful of.
Mhm. And there are cases that, as you said, that persons may become dependent, and some people can function well and use these substances. They don't have to go to the state where you can notice stuff. Some people use these things and function. Do you agree with me? And how do you pinpoint? How do you help a person who uses this? Probably don't want people to know because they're ashamed, or they don't want to be judged. But how do you recognize that there's something that is going on from somebody they're functional, what you call functional drug addicts, or dependent on drugs?
Yes, so that's a good question. Like you said, there are some persons who use substances or misuse substances, and they seem to function well, or at least that aspect of their life that you're exposed to, they seem to function well. However, there are certain issues and with substance use. There's not only the biological meaning, the body that is physically affected, but also you have the social aspect and the psychological aspect that is affected with substance use. So that individual might seem to be functioning well at work, but remember, you cannot see the damages that are being caused with the organs, or you cannot see the mental health damages that are being caused on a daily basis for those persons who are dependent on substances. Hence, why we need to always, always, always advocate for persons not to even experiment with these substances.
And when it comes to getting free from addiction, there is a certain process that everybody goes through. There's some symptoms, well, I won't say symptoms, but certain things like for instance, withdrawal syndrome. I'm told that every addict, once you're addicted to something, it doesn't have to be drugs or alcohol, it could be gambling. You would go through a period that you would find that, especially if you're trying to get free, that you would go through this period that is called. Can you describe what that is, and how do you deal with going through? How do you encourage somebody to keep pressing towards getting free when they're going through this fight basically to get free from an addiction? Because gambling may be an addiction as well, and this has nothing to do with our topic, but it's an addiction, and you go through the same kinds of syndromes and feelings when you're trying to get free.
Yes, so withdrawal syndrome is very real. One time I heard someone describe the pain of withdrawal as if you were breaking their bones. So it's very real. It's a process. However, I'm happy to say that the Drug Demand Reduction Unit would have now introduced drug treatment services.
Mm-hmm.
So we have drug treatment services available right here in Guyana. Actually, we're at the Georgetown Hospital in the psychiatric department, so persons can be referred there. Apart from that, we're on Communal Street at the mental health unit, where we have a drug treatment specialist work with individuals who are not only drug addicts, but persons who might be experimenting or might be using a substance on a regular basis and need assistance. Our services are non-judgmental, they're confidential, so we encourage persons to come out. We encourage persons to, if you have a family member that might have an issue with a substance, reach out to us, and we'll be there to support you through the process. Also, we're working along with partners who have residential facilities for individuals who need that sort of care. Apart from that too, the Drug Demand Reduction Unit, by the end of this year, we would have trained at least 100 treatment specialists throughout the country. So now we're going to have treatment services at the community level at the health centers. So for the first time, the Guyanese population are going to have drug treatment services at the community level, and these services are international standards. The same services that you have in the developed countries, those are some that you will have at the primary healthcare level, which is at the health center level.
And this would include counseling and therapy and different forms of therapy.
Most definitely. This would include counseling, it would include individual counseling, it's going to include group counseling, family counseling. Also, we have alcohol anonymous support groups, we have narcotics anonymous support groups. So we have those services, and we have a support system for persons who might have an issue with addiction.
You touched on alcohol, so let's get into that, because that seems to be an issue we have in Guyana across the board. Because of our culture, as we mentioned earlier, we at almost every function there's alcohol, there's rum there, and some people have an issue with alcohol. They can't control themselves with it. So let's talk about that a bit. A person may ask, I drink alcohol, many people drink it, but why is my friend or somebody I know an alcoholic? What is the difference between somebody who drinks and can get over it, or drink heavily and get over alcohol, and somebody who is hooked? Why are they hooked to this substance?
So you and as well as our listeners, you would appreciate that for all of us, all individuals, although we all have our differences and we are all unique in our makeup. And some people might have some susceptibility to alcoholism versus the others. Similarly, some people might have a different tolerance to others. So for me, a glass of wine might intoxicate me, whereas my friend, he could have an entire bottle and it may not intoxicate him. So it has a lot to do with our biology. It has a lot to do with several other factors. However, like you said, alcoholism is very real in our society, and that is something that we need to change. We refer to it as behavioral change, where you would want to see persons treat alcohol and alcoholism differently. Persons would oftentimes criticize persons for using alcohol or for being alcoholic, but then we have to remember it's a mental health issue, and we have to empathize with these persons and get them the treatment that they need. And like you would have highlighted, the treatment doesn't mean medication, although in some instances you may need to, because oftentimes you have what we call dual diagnosis, where a person might be misusing a substance, like in alcoholism, a person might be misusing alcohol, but that alcohol damages some key and critical organs, such as the liver. And then we have cirrhosis secondary to alcoholism, and that person would be needed to be treated medically for that cirrhosis, for that medical issue. Also, there's something called dementia caused by alcoholism. Dementia, one of the main things we all know about dementia is forgetfulness, amongst others, but that also can be provoked by alcoholism. So there are multiple factors and there are multiple things that we need to be aware of.
So let's talk about, instead of, let's say a person is an alcoholic or they're dependent on alcohol, how do you suggest that that person or their family or whoever, their loved one, make an intervention? Is it possible for an alcoholic to reduce his intake instead of like stopping, just to avoid that, like just bringing it to a full stop, just like that, just to avoid the, the struggle of coming off of this substance? Do you recommend them going on a process of just little by little, less alcohol this week and less next week? Is it, or is it that you have to definitely come to a full stop?
So I'm glad you asked that question. What I would encourage is that if you have a relative or if you're affected by alcoholism, reach out to us. Let a professional be able to assess you and be able to work with you. Our services are non-discriminatory. There is confidentiality, and we can work with an individual. When you say to reduce the amount of alcohol, from the Ministry of Health standpoint, from the department standpoint, we want persons to adopt healthy habits, healthy behavioral choices. So if I can get someone to stop using alcohol completely, I would prefer that option.
I understand completely. In terms of alcoholism in Guyana, I don't know if you would have any give us like an idea as to how many, if this is an area that is more concentrated than the rest in terms of addiction and alcoholism, in comparison rather to the other substances. Is alcoholism something that is on a higher scale? Are more persons addicted to alcohol rather than marijuana or other substances?
So there is no confirmed data. However, because we would have mentioned that in our societal norms, there is the consumption of alcohol at most things. I would say that alcohol is the substance that is mostly used. However, there are certain trends with the synthetic drugs that are worrisome, and those synthetic drugs would include the ecstasy or the Molly that we spoke of, and also there are other what we call synthetic cannabinoids. Synthetic cannabinoids are the synthetic makeup or the synthetic drugs that were developed to mimic the THC in the cannabis. So for now, I think the most trending drugs seem to be Molly, ecstasy, and these are the synthetic drugs.
I understand completely. I've heard that. Let's talk about marijuana, and then we'll talk about those synthetic, the use of those synthetic drugs. Marijuana use is quite common in Guyana. You would agree with me. But there's a certain demographic that drug or that type of substance affects more. Could you speak to the effect that it has on you based on the records that you've seen in Guyana, especially the age range? Who's being targeted more with this type of substance?
So, like you rightfully said, marijuana is one of the traditional drugs or substances that we see people using or misusing. And the in and out of school youth, the younger adults, those are the demographics that we tend to see marijuana using. There's a high incidence of young people who use marijuana currently. Like any other drug, once you're using marijuana, you're susceptible to become addicted to it. The thing is with marijuana too, marijuana has been seen in Guyana as a gateway drug. We usually refer to it as. The reason why we refer to it as a gateway drug, because oftentimes persons start to use marijuana and then they graduate to other drugs that might be more potent than marijuana.
And why does this happen?
It often happens because they're looking for that potency. They're looking for that high, a bigger high. So they tend to use one of these synthetic substances, such as Molly or ecstasy. So they might start with marijuana, they start to get a high, but then after a while, that marijuana, that what we refer to as a joint or a spliff, that spliff might not be giving them the high that they're looking for, and they tend to graduate into cocaine, heroin, or one of these other synthetic substances.
And in terms of using marijuana, there are certain health risks that are involved. I mean, some people, certain group might say, okay, there are certain benefits to using marijuana. I will not touch that. But in terms of the health risks, in terms of abusing this substance, what are some of the complications? I told that there are direct complications when it comes to the brain, and there are other bodily harm that this drug can cause. So can you speak to those issues?
Definitely. So marijuana, like any other drug that you're smoking, the number one organ of concern is the lungs. So in persons who are misusing marijuana, the person who are abusing the use of marijuana, we can see lung cancer. But apart from the lung, like I mentioned earlier, we can have a lot of mental health disorders such as delirium, panic attacks, and these anxiety and so on.
So it can cause you to become delirious and operate on uneasy for no reason, just because you can't get that fix, or you can't feel that I don't know, that level of relaxation that they claim that marijuana gives when you smoke it. Has there been an increase in your view of the use of this product or recently? An increase or a decrease?
So as it relates to marijuana, we've seen use in other demographics, meaning in other age groups. So whereas previously we saw it primarily in the youths, you're seeing it more used in the adult population as well. However, the new synthetic drugs those are the trending drugs right now. Those have overcome even the marijuana use.
And in terms
and
of
these are just preliminary data.
okay, and in terms of the new demographic that this drug is being used by, older persons, they're not using it only in the form of the natural weed, or what we call ganja, smoking ganja. It would be in this form of edibles and so on, right?
Yes, so that is responsible for the greater consumption, because persons now are using it in edibles. You're finding it in candies or candy-like substances. You're finding it in cookies and brownies and all other different forms. You're even finding it they're using other delivery devices, such as the what looks like the e-cigarettes and so on, where people might be using THC oil.
And it would be the same impact on your health. It would have the same impact, even though you're not smoking it.
Definitely.
So we're going into the one that you've been touching on all the while. It would be the synthetic drug. And can you list a few of these that you commonly use in Guyana? Besides the Molly or the ecstasy, what are some of the other synthetic drugs that are available up there in the local sphere?
So the primary one, like you would have said, is the methamphetamine. So the thing with the methamphetamine, like I said, that is the core chemical compound for the synthetic drugs that we're seeing. But what happened, this drug is the drug that is mixed most with other substances. Hence you have the name ecstasy and Molly and so on. Apart from that, we have the synthetic cannabinoids, and there are over 260 new synthetic cannabinoids being registered. The thing is, some of them, they don't even have a name as yet. It's just a chemical compound, and persons are misusing it, or persons are using it. So those are the ones that we are very much concerned about right now. They're so, and the thing is, because they're evolutioning so fast, or they're making these synthetic drugs so quickly, sometimes even your testing capacity is affected because you're trying to keep up with every new drug that is coming out, on a rapid, in a rapid manner.
So you have like over 200 of these types of synthetic drugs that are, out there, and we don't know exactly how much is in there because as you said, that there's so much.
Yes. So that 200 plus is what has been registered in North America and South America, but in Guyana, we're not certain how many of those are here.
And what's the risk of using these substances? Talk about health risks first.
Well, so some of the short-term effects, and I think that is why a lot of people try them. Some of the short-term effects would be enhanced alertness, enhanced energy, talkativeness. Some people feel a false sense of well-being and heightened mood. However, you can also have confusion, anxiety, dizziness, headaches, tremors, panic attacks. Your circulatory system can collapse and you can have a heart failure. They've even noticed persons going into coma, and worse, we have persons who would have died from the use of some of these substances. Those are the biological or the medical consequences, but we can see certain consequences like an increase in road fatalities when persons are under the use of these or under the influence of these substances. It impairs their judgment, and that is responsible for some accidents. Also, you can find, because these substances affect your mood and your perception, the way you think, you've noticed a lot of interpersonal violence where people become aggressive to their loved ones and cause all sorts of bodily harm and even maim people. So substance use have dire effects, not only for the individual who is using it, but also for their family members and the persons that they associate with every day.
And in terms of how do you recognize? Suppose somebody is not telling you, recognize that this person. What are the symptoms that they would exhibit that somebody could think like that? No, this is not normal. I think this person may be. You might not be able to say it, but you can suspect. What are some of these indicators?
So like I mentioned earlier, you could see extreme mood swings. You can see persons avoiding or not being able to complete a particular task, particularly in the working environment, because they cannot concentrate. Also, you can notice aggressive behavior as it relates to hygiene. Hygiene is not amongst priority, so they're oftentimes filthy. Forgetfulness, they have short attention spans. So those are some of the things that we can look for.
And in terms of this new trend, these synthetic drugs, we normally they start with the youth, but I'm told that this one is straight across the board.
No, so we've noticed the Molly and the ecstasy and so on. It's primarily, like I mentioned earlier, the in and out of school youths and the young adults.
Okay. So,
Although we have a low incidence or low prevalence of adults who are trying them as well.
and besides those, the ones that you, the ecstasy and so on, there's quite a significant use, but this one is not really talked about, not cocaine, heroin, and crack in Guyana. How do you deal with how do you deal with that sort of thing? Because most of these people, because it's not something that you can go, probably, I might be wrong, at the market, and like you can go and get marijuana more easily than crack and cocaine. These persons may have their, their secret dealers or whatever. How do you address these persons who use these sorts of substances, and how do you try to help them? How do you, I don't know, intervene?
So there's a two-pronged approach to the drug situation. My department, like it says, is the drug demand reduction. So what we do a lot of education, a lot of prevention, we do treatment, rehabilitation. However, there's another important arm to controlling the drug situation, which is the supply aspect. And as it relates to the supply of these drugs on the market, we have other agencies such as KANU, who is responsible for bringing down that supply in the drugs, bringing down the availability of these substances. And I must add that they've been, doing pretty well recently. You see a lot of drug busts, and so they're taking the drugs off the street while we're working on changing the behaviors of persons who might have or who are seeking drugs.
And do you, I don't know if you have numbers as to the usage of cocaine in Guyana or heroin or crack. Any numbers?
So no, we don't have confirmed statistics. However, there's a department under KANU, the Drug Information Network, and they would provide us with some information. Um, However, I can say that at our rehabilitation centers, we've noticed a lot of persons who are entering for the use of crack cocaine and so on. And those persons are becoming rehabilitated. I'll take this opportunity to mention those two organizations that we work with, and that is the Salvation Army. They do in-house rehabilitation or residential rehabilitation. Also, we have the Phoenix Recovery Project. Both of them do residence rehabilitation program, meaning that once we would have assessed someone and realized there's need for them to be in an institution to overcome their drug addiction, they then enroll into these two facilities and they go through a program in which they oftentimes complete within 6 months, and they're able to be reintegrated into society. They're able to be reintegrated into their community and with their families. And that's the ultimate goal when we face someone who has a drug addiction. We try to reintegrate that person back into society so that they can make some sort of valuable contribution into society. We must appreciate that drug addiction doesn't have a face. It doesn't have a particular social class. It doesn't have a particular educational level. So anyone can become addicted to a particular substance. Hence why we urge persons not even to attempt, not even to try to experiment with a substance, because you don't know your reaction. Your reaction might be different from another person's reaction. That person might be using regularly and remain fine, but after your first use, it can lead you straight to addiction.
And not everybody is able to get free.
That's true.
You mentioned earlier, and I don't know if I touched on it or you touched on it, but this the Ministry of Health specifically is concerned about this rise in synthetic drug use. What specifically are you doing to address that?
So I would have mentioned, yes, drug use is a public health issue. However, it's not only the Ministry of Health's responsibility. But however, for the Ministry of Health and what I'm tasked with doing, we have a treatment program and rehabilitation. Drug prevention is where we develop materials, we educate our in-school youth, we educate our young adult population, we educate the general population, encourage persons to develop healthy, positive lifestyles, to develop healthy coping mechanisms, whilst we have a treatment program, which I mentioned earlier, is now available so that persons who might be addicted or not even addicted, you might be using and you're using occasionally and regularly, and you know that you need help. We are providing drug treatment services. And as it relates to rehabilitation, I would have mentioned to you these two organizations, which the Ministry of Health works along with in providing residential therapy. So we have prevention, we have outpatient or ambulatory treatment. That's where the persons can come here or the Georgetown Public Hospital and soon at a health center near you. We have residence treatment, and also we have rehabilitation program where we help persons to recover and to be reintegrated back into their families.
Thank you. Thank you so much, Dr. Freeman. This brings us to the end of our discussion. For those who listen and tune in, we're very grateful for your attention and for taking time out to listen to Your Health Matters, because your health matters to us, your health matters to society, and most of all, your health matters should matter to you. So that brings us to the end of our discussion today. Thank you for joining us. Thank you, Dr. Freeman, for taking time out of your schedule to come on Kaieteur Radio and talk about illicit drug use and addiction. So that's it from us here at this end. We do hope that you enjoy the rest of your day, and we do hope that we see you on our next program. Until then, goodbye and have a good rest of your week.
Thank you. Stay well.